Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and we're here today with Jessica Eaton, who is the director of our Youth and Young Adults program, which we kind of just created that recently so that we could really put a focus on young people, and especially young people in the sense of prevention and early intervention.
Yes.
Now that you've been kind of involved in some of this, what are some of the trends that you're seeing with younger people and some of the issues that we're dealing with?
I think we're seeing drug use starting at younger ages, kids coming in 10, 11, 12, starting with substances at that age, and then moving into, I'm going to say harder drugs, but it used to be a couple years ago like marijuana and alcohol were kind of the drugs that people were coming in using, and now we're moving into opiates and prescription pills, a lot of the synthetic drugs, spice and bath salts, as well as a lot of behavioral issues, just anger problems, a difficult time communicating because of texting and things like that. They lack those social skills.
They really never develop those interpersonal skills, have they?
Right. So like dealing with disagreements or conflicts, it rises right to kind of the physical or verbal altercations instead of being able to sit and kind of resolve it by talking.
Well, I think people would be surprised on who these kids are.
Yes.
And what we're finding is it's such a diverse group of kids from every neighborhood in the area.
Yes, I think there's that stereotype that it's, low SES kids or kids that come from bad homes or broken homes, but our groups and our people that are coming here are from all over the valley. They're from families that have a lot of money, they're from families that are in the middle, they're from lower SES, they're from homes that have single parents that are still married, so it's not just affecting one kind of kid.
And a lot of these drugs are just so readily accessible throughout the community, and I think especially now that prescription opiates have gotten so big. I mean, most people have prescription opiates sitting in their medical cabinets.
Yes, and that's a big issue, is that kids are getting the prescriptions from the medicine cabinets, from their grandparents' medicine cabinets, and then being able to either they're using them themselves, they're abusing them, or they're selling them to people on the streets. So there's a lot of kind of initiatives in the valley, in the Mahoning Valley, through some of the coalitions to get prescription take-back days. We just had one over the weekend, and there's another one at the end of May, so that they can get properly disposed. Because people don't think about it. They get done taking something, they leave it in their medicine cabinet, and you don't really think about, one of your kids abusing it, but that's where they're getting it from.
Well, and I think that we're recognizing, too, that kids are there's so many challenges that they have now. And one of the things I know that we're looking at is if we recognize kids who are in a high-risk situation, let's try to intervene with them before they get to the point where they're either self-medicating or acting out and getting involved in the legal system.
Right.
And one of those issues, I think, is really around helping kids understand what it means to be in healthy relationships.
Absolutely. I think there's a lot of kids, like we said, with the texting and not having communication skills, that don't understand what it means to be in a healthy relationship, whether that's a friendship or a romantic, kind of dating type thing. Not knowing how to treat each other, not knowing the way that they're supposed to be treated, in particular females, kind of getting in these relationships where they're not being valued, or where they're doing risky things to get that attention from their partner that is not a healthy relationship at all.
And a lot of that, I assume, driven from low self-esteem.
Low self-esteem, particularly in like 7th and 8th grade, going through adolescence and all that, trying to kind of get involved with cliques and not feeling good about themselves. And so if they act a certain way, or are with a boy and doing certain things, then they kind of get that prestige or that esteem, and then they tend to feel better about themselves, but it's a kind of fake or a false self-esteem booster. It's not that internal where I feel good about myself and who I am and what I'm doing.
Right.
I'm doing these things just to get this attention and to fit in and to be accepted in school.
Well, one of the things I think that we want everyone to understand that has a chance to see this is that these problems are, again, pervasive throughout our community. But if you as a parent have a concern about anything that's going on with your kids, you can give us a call at Meridian Community Care, 330-797-0070, and one of our staff will do a free consultation.
Yes.
So if you just want more information, or you're concerned about your child and some of the things that they're doing are making you a little bit nervous, just give us a call and you can come in and talk with us. Again, there's no cost, there's no obligation, but we would recommend that you do that. And you can check out more information on our website at meridiancommunitycare.org. Thanks, Jess.
Thank you.